Imagine going to your doctor because it literally just physically hurts to sit at your desk.
Right.
Or maybe, taking a spin class or even just wearing jeans
Yeah.
has become this source of just constant stinging discomfort.
Yeah, it's
You're
awful.
dealing with this chronic dryness, maybe recurrent infections, and it's actively impacting your daily life, your
Absolutely.
intimate life, your mental health,
Mm.
and you finally bring it up, you finally tell your doctor, and their solution is a dermal filler.
Yeah.
Like the exact same cosmetic gel people use to, plump their cheeks or their lips.
I mean, it sounds almost like a punchline to a bad joke, right?
Hmm.
About modern beauty standards.
Right.
You have this very real, very painful physical ailment, and the proposed treatment is, on paper, an aesthetic cosmetic procedure.
Which is exactly why today's deep dive is just so utterly fascinating to me.
It really is.
Because we are looking at this stack of clinical trials today, including the Isolene study, some really comprehensive anatomical reviews, and the latest aesthetic gynecology guidelines.
Mm.
And they completely upend how we view this specific part of the body.
They really do. It changes everything.
Yeah. We're exploring the science of how restoring volume to the outer labia, so the labia majora, is not, it's not just some vanity project.
No, not at all.
It fundamentally alters daily moisture retention and physically shields the delicate inner vestibule.
Yeah, we are looking at a really profound intersection here between a woman's structural anatomy, local tissue hydration, and just her daily physical comfort.
Right.
Because for decades, if a woman complained about this specific kind of chronic daily discomfort, it was brushed off.
Oh, totally. Just, it's a normal part of getting older.
Exactly. Or, if she sought treatment to change the appearance of the area, it was strictly categorized as just a cosmetic issue.
Vain, yeah.
Right, vanity. But the literature we're examining today proves that this is a false dichotomy. I mean,
Yeah.
we are talking about an anatomical structure that acts as a primary physical, mechanical defense mechanism.
Okay, so to really grasp how a dermal filler could fix a functional, painful problem like this, I feel like we need to understand the baseline engineering of the vulva.
We do, yeah. We have to start at the foundation.
Because reading through these clinical papers, I kept trying to visualize the mechanics of it. And the thing that kept coming to mind is, think of a high-end luxury car.
Okay, I like that. I can work with that. Let's look at the outer chassis versus the interior.
Right. So the outer lips, the labia majora, they're like the thick, heavy rubber weather stripping around those car doors.
Okay, yes.
They are robust, they are designed to face the elements, and their entire job is just to create a flush seal.
Exactly.
And then the inner structures, so the inner vestibule and the labia minora, those are the sensitive, climate-controlled leather interior of that car.
That's a really great way to look at it because the histology of the tissue perfectly aligns with that weather stripping comparison.
Okay, break that down for us.
So the labia majora are composed primarily of fatty or adipose tissue and a thick layer of keratinized skin.
And keratinized means what exactly in this context?
Right, so keratinized skin is what you have on like the rest of your body, your arms, your legs.
Okay.
It features this really tough protective outer layer called the stratum corneum. And crucially, this outer weather stripping is packed with sebaceous and sweat glands.
Oh, right.
Yeah, these are essentially tiny factories producing vital, lubricating lipid secretions.
So they're built to be a physical barrier, a thick protective seal that also lubricates.
Yes. But then, you open the car door and you look at the interior.
And it's completely different.
The landscape changes entirely. The labia minora and the vestibule, which is the smooth, really highly sensitive area surrounding the urethral and vaginal openings, those are composed of non-keratinized mucosal tissue.
Non-keratinized, so no tough outer layer.
Exactly. To put that in perspective, this tissue is much closer in its physical composition to the fragile skin inside your cheek than the durable skin on your arm.
Oh, wow. So it lacks that tough outer armor completely?
Completely. Which leaves it incredibly vulnerable. The barrier function of normal human skin depends heavily on that stratum corneum we mentioned.
Right, the tough part.
Yeah, alongside a very stable lipid matrix of ceramides, cholesterol, and free fatty acids.
Okay.
But because the inner mucosal tissue lacks that thick keratin shield, it is highly permeable.
It just lets things pass right through.
Yes, and the clinical literature really highlights that this makes the vestibule incredibly susceptible to a phenomenon called transepidermal water loss, or TEWL.
TEWL. Okay, let's define transepidermal water loss for a second, because this seems to be like the engine driving this whole problem.
It really is.
This just means water evaporating through the skin. Okay.
Simply put, yeah, it is the passive evaporation of water from the inside of the body out through the epidermis and into the surrounding atmosphere.
Okay, so if the car doors are open.
Right. In a healthy scenario, with the weather stripping fully intact and sealed shut, the moisture is completely trapped. But if that delicate mucosal tissue is exposed to the open air, it acts like a damp sponge sitting in the sun.
Oh, this sounds awful.
The moisture rapidly evaporates. Transepidermal water loss just spikes, and that leads to severe cellular dryness, inflammation, and a totally compromised tissue barrier.
Wow. So the outer lips are literally designed to be a physical lid, like a structural seal to stop the evaporation.
They are. The anatomical texts confirm this as their primary protective function. The labia majora enclose what is called the pudendal cleft.
The pudendal cleft.
Right.
Okay, and that's the physical gap between the lips.
Exactly. And maintaining that tightly closed envelope is what keeps the whole system functioning.
Right.
When those heavy outer doors are shut tight, the delicate interior is shielded from physical friction, shielded from the drying air.
And all those secretions are trapped.
Yes. All those lubricating secretions from the sebaceous glands are trapped exactly where they need to be to constantly bathe the inner vestibule.
Okay, so that is the ideal baseline. But the weather stripping degrades over time.
It does.
Which brings us to the breakdown of this anatomical shield. Because the sources really emphasize that volume loss in the labia majora is not some rare anomaly.
No, not at all.
It is incredibly common, and it happens for a variety of reasons.
Yeah, it's very common. The medical term for this degradation is lipoatrophy,
Lipoatrophy.
which is the literal loss of fat tissue. Aging is a primary factor here, much like how the fat pads in our face diminish and shift as we get older.
Like losing the plumpness in your cheek.
Exactly. But in this specific area of the body, the degradation is heavily driven by estrogen.
Estrogen.
Yeah. Estrogen is essentially the master architect of female anatomy.
Well, we hear so much about estrogen drops causing hot flashes, right? Or bone density issues. But how does it specifically dismantle this physical weather seal?
So there are dense populations of estrogen receptors in the superficial layers of this tissue.
Okay.
Their job is to maintain the health of the epithelium by promoting blood supply and stimulating these cells called fibroblasts.
Fibroblasts. We've talked
Yeah.
about them before.
Right. You can think of fibroblasts as the body's microscopic collagen factories.
Okay, collagen factory, Scott.
When estrogen levels plummet, which happens most notably during the menopausal transition, these fibroblast factories essentially board up their windows and shut down.
They just stop working.
They start producing collagen and elastin. And the adipose tissue, the fat, simultaneously begins to waste away.
But the sources also point out that this isn't exclusively a menopause issue, right?
Oh, absolutely not.
Like, significant weight loss can deplete that adipose tissue too.
Mm-hmm.
And then there's childbirth.
Right.
The sheer physical trauma and stretching of childbirth can stretch the structural ligaments of the labia majora.
Yes.
And that permanently reduces their tone and firmness, even in much younger women.
That's right. And the mechanical result, regardless of what caused it, is deflation.
Deflation.
The skin of the outer labia loses its internal scaffolding. It begins to sag, it wrinkles, and it just flattens out.
So the tight, flush seal of the pudendal cleft is broken, the car doors are open.
Exactly. The seal is broken.
There's a very specific word the literature uses for what happens next, and I thought it painted such a vivid picture.
What's that?
They call it the unveiling.
Ah, yes. The unveiling.
Because the thick outer lips have deflated and pulled back, they unveil or expose the labia minora and the clitoral hood.
Right.
Things which were previously tucked safely behind that barrier.
And this specific point, this unveiling, is where the medical community has historically really failed patients.
How so?
Well, a woman might look at the physical changes, feel the discomfort, and present to a doctor with what sound like a cosmetic complaint.
Like she's saying it doesn't look right.
Yeah, she might say, my inner lips are protruding, things are rubbing, it doesn't look or feel right.
Right.
And too often, the doctor dismisses it as just a mild aesthetic change due to aging.
It's just a cosmetic vanity thing.
Exactly. But the functional consequence of that unveiling is actually a physiological crisis.
Wow, a physiological crisis.
Oh, it is. First, as we established, the moisture seal is permanently broken. That transepidermal water loss accelerates into overdrive, resulting in this chronic, unrelenting vaginal and vulvar dryness.
Right. But dryness is just one thing. Then we introduce mechanical friction.
Yes, the friction is massive.
If those delicate intermucosal tissues, the leather interior of the car, are hanging outside the protective envelope, they are suddenly rubbing against cotton underwear,
Right.
tight denim, bicycle seats. The sheer friction on tissue that was never, ever biologically designed to endure it,
Never.
that creates micro tears and chronic inflammation.
Yes. And the sources explicitly link this specific structural failure to dyspareunia.
Which is the medical term for pain during sexual intercourse.
Exactly. Without the physical padding of the majora to act as a shock absorber,
Huh.
and compounding that with the severe dryness from all that moisture loss, intimacy becomes physically traumatic to the tissue.
It makes complete sense mechanically when you put it like that. But the cascade of failures goes even deeper than just friction. Reading this, I was shocked to see that the breakdown of this physical shield actually triggers a collapse of the microscopic ecosystem.
Yeah, it's fascinating. Structural anatomy dictates microbiology in this environment.
Okay, unpack that for a second.
So, a healthy vaginal and vulvar microbiome requires very strict parameters to survive.
Right.
It needs to be consistently moist, and it needs to be highly acidic, usually maintaining a pH below 4.5.
Okay, so low pH.
Right. This specific acidic environment is what favors lactobacilli. Those are the good bacteria that produce lactic acid and actively protect the area from invasive pathogens.
But the weather seal is broken. The doors are open. The air is getting in.
Exactly. And the environment immediately becomes hostile to those good bacteria.
Wow.
The moisture evaporates, the friction causes inflammation, which actually alters the tissue's immune response.
It's all connected.
It is.
Yeah.
Furthermore, the loose, deflated folds of the outer skin can now trap sweat in abnormal ways, which further disrupts the local pH balance.
Oh, I see.
And when the pH spikes, the lactobacilli die off.
Leaving the door wide open for whatever else wants to move in.
Unfortunately, yes. And that usually means chronic itching, recurrent yeast infections, or bacterial vaginosis, commonly known as BV.
Oh, man.
The patient is trapped in this cycle of infections, treating them with creams and antibiotics without ever realizing the root cause is that the physical architecture housing the microbiome has collapsed.
Okay, I have to play devil's advocate here for a second.
Go for it.
Because I am looking at this cycle, dryness, friction, infection. And if the core issue is a lack of moisture and a drop in estrogen, why are we talking about dermal fillers?
It's a fair question.
Why wouldn't a doctor just prescribe an estrogen cream to wake up those fibroblasts or tell the patient to use a heavy daily moisturizer? Why inject a cosmetic anti-aging gel?
It is a vital question. And to be clear, estrogen creams and moisturizers are frequently the first line of defense.
Okay.
And they certainly help improve the tissue quality on a superficial level. They can soothe the mucosa and help replace some of that moisture.
Right, they provide some relief.
But they cannot rebuild lost adipose tissue. They cannot recreate the physical three-dimensional volume required to actually close the anatomical gap.
Right.
If the structural doors are physically standing open, slathering the interior in moisturizer won't stop the wind from blowing in. You have to close the gap.
You have to replace the missing weather stripping.
Exactly. And this is where adapting a highly successful facial rejuvenation technique for functional gynecological repair comes into play.
Okay, here we go.
The clinical literature focuses really heavily on injecting specific cross-linked hyaluronic acid fillers.
We see that as HA in a lot of the literature.
Right. HA products like Deserial Plus, Novia Rose, and Regenual Harmonia, they inject these directly into the deflated labia majora.
So let's get into the mechanics of this intervention. What is the actual mechanism of action when a practitioner injects HA into this specific tissue?
Okay, so hyaluronic acid is a naturally occurring polysaccharide in the human body.
It's natural.
Yes, and its defining characteristic is that it is a profound moisture magnet. It literally binds to water molecules.
Okay.
So when an experienced practitioner injects a dense, cross-linked HA gel into the adipose layer of the labia majora.
And they use a cannula for that usually.
Yes, usually using a blunt-tipped microcannula to minimize trauma and bruising.
Right.
It immediately acts as a physical scaffold. It restores the lost volume and plumps the tissue back to its original dimensions.
It reinflates the deflated structure from the inside out.
Mechanically, yeah. That added volume pushes the inner edges of the labia majora back toward the midline.
Oh, I see.
It physically closes the pudendal cleft. The weather stripping is flush again.
And by shutting that gap, the physical shield is fully restored.
Exactly.
The delicate inner vestibule and the labia minora are once again tucked safely inside, protected from the drying air, and shielded from the friction of clothing.
Right.
And the sebaceous gland secretions are trapped where they belong, drastically reducing that transepidermal water loss. The moisture is locked in.
Yes, the structural repair is immediate. But the mechanism goes beyond just acting as an inert, temporary space filler.
Right.
The sources highlight a fascinating biological response to the HA gel itself.
The tissue remodeling. I saw this phrase, de novo collagen production.
Yes, they
Meaning making brand new collagen from scratch. How does injecting a moisture-binding gel trick the body into growing new structural proteins?
It actually comes down to mechanical tension.
Tension.
Yeah, when you inject the filler, you are physically stretching the deflated tissue from the inside.
Okay.
This physical stretching actually pulls on those dormant fibroblasts we talked about earlier.
The ones that boarded up their windows.
Exactly. The mechanical tension literally wakes them up. The cells perceive this stretching as a signal that they need to build a stronger matrix to support this newly expanded environment.
That is wild.
So they begin synthesizing de novo collagen and elastin.
The filler forces the body to repair its own scaffolding.
It does. Studies on HA injections in human tissue show this new protein expression is visible in as little as 4 weeks.
Just a month.
Yeah. Some of these specific gynecological fillers, like Novia Rose, they even include amino acids like glycine and L-proline right in the gel.
What do those do?
They are the raw building blocks the fibroblasts need to make that collagen.
Oh, wow. So it's giving them the fuel, too.
Yes. Over time, the procedure fundamentally improves the intrinsic structural integrity, tone, and elasticity of the labia majora, even as the body slowly absorbs the HA gel.
You know, understanding this mechanism, it completely flips the narrative on a very common and honestly much more invasive surgery.
You're talking about the labiaplasty.
Yes, the labiaplasty. I was reading through the surgical guidelines included in our sources, and there's a massive paradigm shift happening here.
Massive.
Because historically, right, a woman comes into a clinic complaining of friction and protrusion. She thinks she needs her inner lips surgically reduced.
Minora amputation.
Yeah, she thinks they need to be cut off because they are hanging out.
Right.
But in reality, her inner lips haven't grown at all.
Yeah, they have.
Her outer lips have deflated and retreated.
And the clinical guidelines now explicitly warn surgeons about this exact misdiagnosis.
It makes so much sense.
Because reducing the labia minora in a patient whose primary issue is actually majora volume loss, it can severely worsen the aesthetic outcome. And worse, it overcorrects a structure that was never the problem to begin with.
Right, you don't rip out the car's interior just because the weather seal degraded. You fix the seal.
Exactly. It is a critical distinction because surgical excision of mucosal tissue carries significant risks.
Oh, totally.
You are looking at potential bleeding, nerve damage leading to impaired sensitivity, scarring, and a really painful, prolonged recovery period.
Yes, major surgery on a very sensitive area.
Right. Conversely, restoring volume to the majora with HA fillers is a minimally invasive outpatient procedure.
Right in the office.
Yes, it is performed under local anesthesia in a clinic setting with virtually no downtime. Patients walk out and resume normal activities almost immediately.
The structural logic is incredibly sound. The biology makes perfect sense. But as someone who always wants to see the receipts.
Show me the data. Right.
Exactly. Let's look at the data.
Yeah.
Because we have specific clinical trials in this stack, does plumping the outer labia actually measurably improve a woman's day-to-day life?
The clinical data strongly validates the anatomical theory.
Okay, give me an example.
Let's examine the Isolane study. This was a prospective, multi-center clinical trial involving 73 women who were treated with the filler Deserial Plus.
And this was specifically for that volume loss.
Yes, specifically for labia majora hypertrophy, which is that severe volume loss.
How do they even measure success in a trial like that?
They utilize standardized medical indices. So one is the Global Aesthetic Improvement Scale, or GAI.
GAS, okay.
It is a 5-point scale where both the treating physician and the patient independently rate the visual improvement compared to the baseline.
Okay, so what were the numbers?
At 12 weeks post-treatment, 97% of the women reported a positive aesthetic improvement.
Wow. 97%.
Yes. And what is particularly compelling is the longevity of the intervention. High patient satisfaction rates, over 92%, were maintained up to 52 weeks.
A full year after the injections.
A full year, yes.
That is incredible. But that covers the aesthetic side. What about the functional crisis we discussed? The dryness, the friction, the inability to sit comfortably.
This is where the barrier restoration really proves its worth. The study authors documented that the filler treatment was directly associated with a highly significant reduction in physical symptoms.
Okay, like what?
The chronic itching, the burning, and the mechanical irritation from clothing were profoundly alleviated.
Because the moisture was successfully trapped.
Exactly, and the delicate tissues were physically shielded again. Furthermore, the patients reported a significant improvement in sexual function, alleviating that dyspareunia we talked about.
Which is completely backed up by the second major trial in RSAC, right? The randomized controlled trial. Yes, the RCT, the gold standard of clinical research.
Right.
So this was a well-designed RCT involving 76 women. They compared a control group receiving no intervention against a group receiving the specific HA fillers.
Okay.
And they evaluated outcomes over a 6-month period using the Female Sexual Function Index, the FSFI.
Now, the FSFI isn't just one broad question, right? Like, are you feeling better? It breaks down the mechanics of intimacy.
It is a comprehensive, multidimensional self-report instrument. It measures domains like arousal, natural lubrication, and pain.
Okay, so it gets really granular.
It provides a very quantifiable score of a woman's sexual well-being. And at the 6-month mark, the women in the HA filler group demonstrated highly significant, measurable improvements across their FSFI scores compared to the control group.
Wow.
Their lubrication improved because the TEWL was halted. Their pain decreased because the structural padding was restored. I mean, think about what this means for the person listening to this right now.
Yeah.
If you have been sitting in a doctor's office, trying to explain that something as simple as riding a bicycle or wearing jeans has become agonizing,
Right.
and you've been met with a shrug.
We're told it's just in your head.
Right. This data validates your experience. It proves that your pain is real, it is measurable, it is a documented anatomical failure.
Right.
And most importantly, it is highly treatable without invasive surgery.
Absolutely. It really mandates a shift in how the medical community views this anatomy.
Vaginal skin is skin.
Vaginal skin is skin. Its barrier function is every bit as critical to overall health as the skin barrier on your face or your hands.
Yeah.
When that specific barrier fails, the physiological consequences cascade through the patient's entire life.
So restoring that outer cushioning via a dermal filler isn't vanity.
No, not at all.
It is a highly effective, scientifically validated method of rebuilding a failed mechanical shield, locking in vital moisture, and stopping a cascade of inflammation.
And if we follow the logic of that cascading failure, particularly regarding the microbiology we discussed earlier,
Right, the microbiome.
it leads to a rather radical question about the future of preventative women's medicine.
Oh, I am always here for a radical question based on clinical data.
Yeah.
Where does this lead us?
Well, we established that a robust, healthy vaginal microbiome relies absolutely on a moist, highly acidic environment.
Yes, the low pH, the lactobacilli.
Right. We also established that a compromised physical barrier, that deflated weather stripping, allows air in, dries the tissue out, spikes the pH, and decimates those protective bacteria.
Right.
This structural failure leaves women highly prone to chronic, recurring internal infections like BV or yeast.
Because the ecosystem's climate control is just totally broken.
Exactly. So, if restoring the outer labial volume with a simple outpatient hyaluronic acid filler successfully reseals that anatomical envelope.
Right, it stabilizes the internal moisture.
Yes, and it protects the vestibule from pH disruption.
Oh, wow, I see where you're going.
Could we one day see these supposedly aesthetic dermal fillers prescribed not just for comfort, but as a primary preventative medical treatment?
You mean prescribing a filler to stop chronic infections?
Exactly. For women trapped in this cycle of suffering from chronic internal bacterial or yeast infections, could fixing the external architecture be the ultimate long-term cure for the internal ecosystem?
That is mind-blowing.
Isn't it?
I mean, we spend millions of dollars and countless hours prescribing oral antibiotics, antifungal creams, and, specialized internal probiotics, desperately trying to fight the microscopic infection.
Right, throwing everything at the symptom.
But we might just need to fix the literal front door.
Exactly. We are constantly treating the downstream symptom of a collapsed ecosystem instead of repairing the physical structure that houses it.
It completely dissolves the boundary between aesthetic enhancement and functional preventative medicine.
It forces us to look at the human body as a fully integrated machine. You simply cannot separate the physical structure from the biological function. They dictate one another.
A structural problem requires a structural solution.
Precisely.
Wow. Thank you all for joining us on this deep dive. Keep questioning the assumptions around you. Keep demanding clinical answers when your body tells you something isn't right. And remember, sometimes the key to protecting the most delicate systems is simply making sure the outer seals are holding strong. We'll see you next time.